Good evening, everybody, and thank you for your kind invitation here in this conference. My point is to go to some of our experience in research regarding some hidden associations of diabetic neuropathy, because we are all well aware about the classical components of diabetic neuropathy and the classical associations of diabetic neuropathy, we know also that there are some hidden things regarding neuropathy, some hidden things which might lead to some important aspects. Now, since it's quite a late hour, we are a little bit delayed, and in fact, here in my local time, we are now at 9 p.m. In fact, I will go straight to the point, because yes, we know that diabetic neuropathy is a real public health issue. Thinking about its prevalence in patients with diabetes, thinking that approximately half of the patients with diabetes will have diabetic neuropathy sometime during their diseases, and thinking that diabetes has a high prevalence, we can make a rough estimate that sometime will reach to populations of patients with diabetic neuropathy in the world, which is somehow very near to a populous country, because a rough estimate will lead to somehow a population of patients with diabetic neuropathy similar to the population of a large country like US. Definitely, we all know that the consequences of neuropathy are a major burden of public health, and definitely this will lead to important costs, and not only costs for the public health, which leads to the fact that diabetic neuropathy is an important public health issue nowadays. And now we are not thinking just regarding subpopulations of patients with diabetes, but we are thinking about a major issue regarding global public health. Now, when we are thinking of diabetic neuropathy, most frequently we are thinking about the classical things associated with diabetic neuropathy, like the consequences of peripheral neuropathy. We are well aware about paresthesia, burning sensation, cramps, or hyperesthesia. We are well aware about the complications of autonomic neuropathy, like the cardiac neuropathy, urinary incontinence, gastroparesis, excessive sweating, or sexual dysfunction. And nowadays, we are very well aware that diabetic neuropathy leads to complications from the head to the toes of our patient, because mainly we can discuss about complications in each component of the human body which are brought by diabetic neuropathy. However, we thought that we should fear for more regarding diabetic neuropathy, and now I'm going to talk about some of the complications of diabetic neuropathy we've researched here in our diabetes center in Timișoara. We hypothesize that mainly mediated by peripheral neuropathy, which may lead to muscle weakness, abolition of reflexes, loss of balance and coordination, impairment of sensory movements, as well as lack of coordination, as well as with components of autonomic neuropathy like postural hypertension, light to dark accommodation, visual accommodation, or impairment of the muscle tone, we might have some impact regarding the gait and the balance of our patients. This is why we studied the association of diabetic neuropathy and balance and gait in patients with diabetes. For this, we've performed a series of tests for the diagnosis of diabetic neuropathy. We've used the Michigan Neuropathy scoring instrument, and yes, mainly this is a qualitative diagnosis test for diabetic neuropathy. However, we thought that if a patient has more components positive at this Michigan instrument, definitely he's going to have a more advanced neuropathy-related symptoms. This is why we also use the scoring from the Michigan Neuropathy screening instrument for the ranking or stadialization of the number of symptoms. We haven't used it as a scale measurement for this kind of analysis. However, we thought that if a patient has more points at the Michigan scoring instrument, definitely he's going to have a more advanced neuropathy-related symptomatology. Regarding gait and balance in these patients, we've used 4 instruments. The first instrument was the Bear Balance Scale, which in fact is an instrument in which a proctor assesses how the patient manages to do some specific but simple tasks like sitting and standing unsupported, and so on. And he gives a score for this kind of independence activities. A higher score for the Bear Balance Scale is associated with a better balance and gait in this patient. Also for this kind of test, we've used the single leg stance score, which counts how many seconds a patient can stay on just supporting on one foot, as well as the timed up and go test, which is a simple test in which the patient has to stand up from a chair, has to walk 3 meters, avoid an obstacle, and then come back and sit on the chair, as well as the FSI instrument, which assesses the falls efficacy scale, in fact, which is test for the subjective assessment of the fear of falls in these patients. The results of our study showed that if a patient has a higher score in the Michigan Screening Neuropathy instrument, he's going to have a lower score regarding the Berg Balance Scale. This kind of test is going to be associated with a higher time needed to perform the single leg stance, as well as he's going to have a more pronounced subjective assessment regarding his fear of falls. Definitely, this showed us that a higher MNSI score in the patients with diabetes and diabetic neuropathy is associated with an increased risk of falls in these patients. And having in mind that these patients are having diabetes, and many of these patients are having a higher age, which is associated with a decreased prognosis regarding the recovery after a fall, definitely we can definitely say that these patients with diabetic neuropathy are at a higher risk for falls, as well as a decrease regarding the prognosis of the healment after this kind of falls, which may lead to another component regarding diabetic neuropathy, that diabetic neuropathy may lead to falls, and thus may lead to another problem regarding the public health systems in this kind of patients. Thinking about the higher number of patients with diabetes neuropathy, and that diabetic neuropathy may lead to a decrease in the balance and the gait of these patients, definitely we might think of a hidden association of diabetic neuropathy, which might be in fact this risk of fall, which is very important for the prognosis of our patients. Another hidden association of diabetic neuropathy is related to the diabetes self-care activities of our patients. We are all well aware that the self-management of diabetes is very important for all of our patients, and the decreased self-management or a decrease in the quality of the self-management of diabetes is going to lead to a decrease in the glycemic control as well as the prognosis of our patients. What we observed, that patients with a more pronounced neuropathy-related symptoms are usually having a decreased quality of diabetes self-management, which might lead in fact to a loop. If the patient has neuropathy, according to our study, usually he's going to have a decreased quality of self-management of diabetes, which in fact is going to lead to a more pronounced diabetic neuropathy symptomatology and so on. Thus, decreasing, in fact, the quality of the management of diabetes, which is a worrisome component. This emphasizes the need of a proper education for patients with diabetic neuropathy, since we all know the importance of quality management of diabetes control in this patient, especially if the patient has diabetic neuropathy, knowing that at the foundation of the interventions regarding diabetic neuropathy, we have in fact the control of diabetes and the glycemic control. Another component we've studied in a similar cohort of patients was the association of diabetic neuropathy symptomatology to the quality of life perception in this patient, and this is somehow predictable. However, our study pointed out that the presence of diabetic neuropathy is a strong predictor for the decrease in the quality of life of our patients with diabetes. Definitely, we can estimate that yes, a patient having diabetic neuropathy symptoms is more likely to have a decrease in the quality of life perception based on the symptomatology of diabetic neuropathy. We've observed this kind of association with also with other components or complications of diabetes. However, the strongest predictor for the decrease in the quality of life in patients with type 2 diabetes was the severity of diabetic neuropathy, which, as I previously said, is somehow predictable for our patients. Definitely, there are more other components which might seem hidden, like the association with the silent myocardial ischemia, because definitely the diabetic neuropathy is a strong predictor for developing silent myocardial ischemia as well as silent myocardial infarct, which might lead to a prolonged time for intervention for this myocardial infarction. We also have a strong association with peripheric artery disease, which in fact are strongly and synergic, acting as predictors for diabetic foot, as well as ulcers and complications, as well as amputations in this kind of persons. And definitely we cannot skip this kind of fear of silent hypoglycemias, because regarding diabetic neuropathy, we all know that a patient with severe neuropathy has silent hypoglycemia, has hypoglycemia unawareness, and definitely his reaction to the presence of hypoglycemia as well as the detection of a hypoglycemia are very much impaired. And the problem is that in patients with diabetic neuropathy, which autonomic neuropathy might lead to an increase in the cardiovascular risk, an association during the night with an hypoglycemia, especially if the patient has hypoglycemia unawareness, might lead to severe complications, which also is associated with the dead in bed syndrome, very frequently encountered in patients with diabetes and severe diabetic neuropathy. Definitely, this was a brief overview of some of the hidden associations of diabetic neuropathy. These hidden associations were already proved in our studies, and definitely I think this kind of complications of diabetic neuropathies are showing us that diabetic neuropathy is not only the thing which might very easily be diagnosed in our medical offices. However, diabetic neuropathy might lead to some other consequences which are not all the times evaluated in our patients, and which may become a real public health issue, considering the number of patients with diabetic neuropathy as well as diabetes. Thank you very much for your attention during this evening, and I hope this presentation brought in the spotlight some aspects which are not so frequently discussed when we are discussing about diabetic neuropathy.